But for us in Dominica, at this time we are witnessing an increase in what we refer to as persons coming down with flu-like symptoms. And when we look at our pattern over the years, actually, around this time of the year, we normally see an increase in persons with flu-like symptoms. So it's pretty much above what we refer to as our normal averages or threshold numbers, particularly in persons grouped as above 5, and we're witnessing increased numbers in those persons who present with symptoms like fever, generalized body ache, vomiting, diarrhea, running nose. These are the general symptoms that patients are presented with. We do not have any death from persons presenting with flu-like symptoms at this time. That is, persons presenting with acute respiratory illness at this time. We had just one admission to date in terms of a person who presented with acute respiratory illness. So we think that we have to, or we in fact not think, we are monitoring the situation very, very carefully. We have in fact increased our public intervention measures. We have increased our surveillance nationally, as you're aware that we do meet regularly. Our national public health surveillance team meet regularly and monitor the situation island in terms of these communicable diseases. So it's something that the Ministry of Health is paying particular attention to, particularly with regards to some of the situation occurring in the neighboring islands at this time. We think that measures that have been used in the past and we continue to encourage have worked. We like to encourage or advise the general public to continue to wash their hands with soap and water as often as possible. Or if you don't have water and soap, use hand sanitizer. Avoid coughing into your hands. Avoid sneezing into your hands. And if you do cough or sneeze, use a tissue, a clean tissue, to bar your nose and your mouth, and to dispose of this tissue immediately in a garbage then upon first use. These measures we think have worked. In fact, it was only last week we were looking at our trends and realized that on the onset of pandemic influenza, that is the H1N1, when we introduced those measures with the increased public awareness that all of our communicable disease patterns that were in fact down. Apart from this week, we noticed that there seems to be an increase in numbers, as I said, with flu-like symptoms. We will increase our surveillance at our port of entries, particularly at our main airport. We will be distributing health information in the form of a card to all passengers who will be arriving, advising in terms of some of the precautionary measures that they need to take. If you come down with flu-like symptoms, obviously we are advising that you stay away from the general public, avoid congregating at this time. If your child has any flu-like symptom, please avoid sending your child to school at this time, because the flu can spread very, very easily and quickly in whenever persons are congregating, particularly in schools. We said recently, and we like to re-emphasize it, and in fact congratulate the bishop for an action which he took some months ago at the onset of the situation, that is the H1N1, in that he advises worshippers that during the time of worship to avoid kissing, hugging, and I think handshaking. We like to encourage all churches to do the same. That is, we notice that there is an increase in flu-like symptoms, and these are some of the measures, actual measures that one can take to avoid the spread of the disease at this time. Dominica, as I speak, only recorded 2 confirmed cases of the H1N1, or commonly known as the swine flu. In fact, those are old cases. And the cases have been are completely recovered and are well integrated into society. We continue to do our sampling, and we continue to work very closely with our regional lab based in Trinidad, the Caribbean Research Epidemiological Center, that is based in Trinidad, as one of our reference lab. So it's a situation where the public should remain calm. We cannot declare at this stage that we have an outbreak. What we can say in terms of flu-like symptoms, definitely not in terms of H1N1, but obviously, as I said, we're witnessing increased activities in persons coming down with flu-like symptoms. We expect those numbers to increase, particularly very soon. We'll be going into the Creole Festival, and there'll be a lot of visitors coming into our island. Again, we encourage persons that social distancing is one of the measures to avoid the spread of the flu. By social distancing, we mean try to stay away from an individual who is coughing or sneezing at least 3 meters. It is recognized that that the virus has a certain distance it can travel, and once you practice the social distancing measures in terms of at least 3 meters away from an individual who is coughing and sneezing, it's very unlikely that the virus will be transmitted further than that distance. We will continue to work very closely with the schools in terms of the messages at the assemblies, to encourage all principals and the staff to speak on a daily basis to the students with regards to hand washing, with regards to cough etiquette. And again, if you notice that a student coming to school with flu-like symptoms, so obviously to work very close with the parent to ensure that child stays away from school, because we don't want the virus, that is the flu, to spread among the school population. We at this time, in fact, we work very closely with the Pan American Health Organization, who have circulated some guidelines, and one of the things that they have noticed is that they strongly advise, I should say, with regards to the closure of schools. So we are not thinking about these draconian measures, certainly not at this time. All right.